In the United States, about 20% of our paychecks go towards healthcare. In other countries, it's about 10%. So we pay almost double, but there's a lot of evidence that we don't get as much as other countries get. So we can clearly do more for less. I see three challenges confronting us. The first is to insure the uninsured. Insuring the uninsured is incredibly valuable for two reasons. First, when Americans are not insured, they are subject to massive out-of-pocket spending at the time of a medical crisis. Many Americans are willing to pay something to make sure that they don't incur these big medical bankruptcies every time they fall sick. The second reason is when people show up in the Medicare program at the age of 65, they're going to be a lot sicker if they were uninsured in their 30s, 40s, and 50s. It's actually a lot cheaper to take care of these people in their 30s, 40s, and 50s. It's like prevention. It's like investing in prevention. The second challenge that we face is making sure that the quality of care that Americans receive is actually commensurate with the cost of that care. So we have to improve quality and bring down costs. And I think the best idea on how to wrestle with the challenge is to get rid of the way we reimburse doctors and hospitals. Fee-for-service medicine, which is what we have in the United States today, incentivizes doctors to think of the human body as 15,000 separate billing codes. We have to move away from paying doctors and hospitals more because they did more to patients to paying them more because they actually kept the patient alive, happy, and healthy. The third challenge that we face is the challenge of dealing with new medical technologies. And let me give you an example. Proton beam therapy accelerates a very fine beam of protons to zap the cancerous cells in a man's prostate. This technology, just to set it up, costs $150 million. And this is before the first patient is treated. And we have absolutely no idea if this technology is superior in any way to conventional radiation therapy. And yet, we reimburse for this medical technology in the Medicare program. And so a larger and larger share of tax revenues are being diverted to spend on healthcare. That by itself is not a problem if the healthcare was actually valuable, as it is when we insure the uninsured. But when we spend on shiny new medical therapies with dubious medical benefits, we are diverting money out of schools to pay for healthcare. The effect of good schools and better education on health far exceeds the effect of good healthcare on health. And so diverting money from schools into healthcare is a guaranteed way to keep us poor and keep us sick.